So I just wanted to share what I'm working on at the moment, really, and where my attention is going. So obviously you've seen probably my really early videos, just where I'm talking about all of the manifestations and symptoms. And then maybe midway through, I made that theory video talking about my hypothesis of schizophrenia and turning it into reframing it into a diagnosis of reality distrust disorder. And so at the moment, I'm working on writing a book called RDD. And the more I research and the more I'm looking to put into the book, again, the more my insight is having an opportunity to articulate itself. And I feel at this point that changing the definition of adult onset schizophrenia to reality distrust disorder is going to allow for the treatment to radically change and in a really positive way. So we know that adulthood onset schizophrenia is polygenic. It has lots of different genes that are found to be similar across people with the condition. However, there's people with none of those genes that develop adulthood onset schizophrenia, and there's people with the highest risk of those genes who don't develop schizophrenia. And so you can quite accurately say, and all of the modern literature supports this idea, that genes don't cause schizophrenia. When you look at something like a genetic disorder, sickle cell disease or something, you can see that there's a mutation in the cellular structure in the DNA that causes the disease, so it becomes synonymous. The genetic mutation causes the disease. In Down syndrome, for example, I think it's called trisomy 21, not sure. It's that combination of that extra chromosome. It's called trisomy 21, I think. And that gene is only found in people with Down syndrome. You don't have anyone who's got that genetic formation that doesn't have Down syndrome, right? So you can purely say that's genetic. That's a genetic condition. You can see the genetic change, and then you can see the result, Down syndrome in this case. With adulthood onset schizophrenia, that's not the case. There is no gene specifically responsible for causing the condition, and in the literature now, what's shown is that there isn't even a collection of genes that are shown to cause the condition. There's only a bunch of genes, polygenetic genes, so a group of genes, many gene, that instruction set. So there's only a collection of them. And when you look at childhood onset schizophrenia, it's actually more obvious to see novel mutations related to the condition, as if childhood onset schizophrenia is a different condition. And so the line of thinking that I'm going down is to break down the symptoms, say hallucinations, paranoia, delusions, and see them as things that actually do exist in the average person. So in the case of paranoias, people who think that they're doing something they shouldn't be doing, or feel like their workplace maybe has fostered an environment where everyone's trying to catch each other out, will experience elevated paranoia. In people with schizophrenia, the elevated paranoia seems more detached, but usually it's because the thought landscapes that they're going to are leading to these paranoid states, because they're worried what they're thinking is in some way not allowed by the world they live in. And I think there's essences of truth to that. And so in the case of, say, hallucinations, the average person experiences hallucinations, phantom phone vibrations, experienced in many people who are healthy, otherwise have no mental health condition, poor condition. Delusions, for example, we all know that there's people like Alex Jones that talks about lizard people and aliens, and there's other people that get up even on stages and profess very strange experiences or abductions or paranormal experiences that might be considered delusions. However, in people with schizophrenia, for some reason there's a disconnect in seeing that those people hold delusions, whereas other people can hold things that might not be considered delusions because they're more collectively acceptable delusions. And so RDD is this idea that trust is a quality, and I don't know if anyone's read Dante's Inferno, but at the bottom of Dante's Inferno is betrayal. And then there's this concept of Jacob's ladder in the biblical sense of the highest achievement of man, the place where heaven is, the way to heaven. And I believe that if there is an inversion of this, say, an opposite, that if betrayal is at the bottom, trust is at the top. And that aligns with the literature again in relation to this condition. Because if genetics aren't the primary cause, and instead it's a multi-hit hypothesis, which is something you can look up online for adulthood onset schizophrenia, AOS, which is that environment and epigenetics are actually the cause. So genetics create a predisposition, and then childhood environment, is the cause of the condition itself, as a combination of those two things really, but more I think on childhood is my idea. Bad childhoods break down trust. It's a betrayal in a very deep way. It might not be the person's intent to do something like this. We live in a world which is very disconnected and chaotic at the moment, but its effect is nonetheless the same. The child grows up distrustful. And distrustful, if the betrayal is at the bottom of hell, for example, then distrust puts you there. It's a betrayal that leaves you in that place. And so these symptoms, I believe, are just existing in normal people. Normal people have hallucinations, normal people can have delusions, normal people can have paranoias and, depressions, for example, periods of depression and faulty identity formation. All this stuff exists in the average person. But because the nervous system doesn't have that trust, say, that other healthy controls have, there's more of a neuroses. So instead of just having maybe some slight delusions or some slight paranoias or hallucinatory experiences, which are common in the world that we live in, say, these are just made so much more worse. But at the core of it is trust, in my opinion. Now, if someone manifests psychoses and it's very extreme and it seems to be having all kinds of tendrils in places that don't make a lot of sense, I think the burden of responsibility falls upon all of us to make sense of those experiences for people, to expand the fabric or the construct of reality that we have to include those questions and those fears and those paranoias. People who are more likely to have those sensitized genes or to have highly distrustful experiences, I think just find themselves in worse messes, right? So you can find all of the symptoms in schizophrenia, I think, in healthy controls. But due to the distrust, those experiences are amplified. And so renaming it to a reality distrust disorder, what I think that does for adulthood onset schizophrenia is immediately remove the pressure that this is a genetic disease and that you're just going to get worse and worse and worse and it's going to be progressive. And it flips the script and says it's not genetic, genetics make it worse, but epigenetics, the ability for environment, thought, behavior to change the expression of your DNA, is where the power is. And so all of a sudden the story becomes more about what that person can do to restore trust to themselves. Maybe that's through bravery, maybe that's through therapy, or hopefully some caring individuals who can take good care of those people. And also what they can do into helping discipline their mind to think about healthy thought habits, recognizing that they might be more distrustful, they might make things worse than they need to be. And then also from the therapeutic angle, how often do we hear about therapy that starts with trust exercises? How often do we hear about a doctor that sits with a patient for a few weeks to get to know them before they even diagnose them? We don't. And so when you rescue a stray dog, you don't immediately start doing training with that dog or start doing tall jumps and hoops and things, especially if that stray dog has got trauma. What you do is you sit with the stray dog for weeks or months, however long it takes, until that dog starts to come out of itself again. Now, humans aren't that simple, and maybe that's not something that's in our current reach at the moment, but then that leads me on to when I hope RDD becomes, if I can flesh it out enough to make people realize that I think that I'm right with this, we can have specialized hospitals which are like that start out as social clubs, that start out so that when a person finds themselves in a really extreme situation, they can actually have an environment where they can just feel safe and trusting and relax a bit and just know that in this environment they're perfectly safe, nothing's going to happen, and they can just start to ease into feeling comfortable before being confronted with having to relive their traumas that can re-traumatize people, or having to be confronted with injections and strong medications from the get-go, which, if you think about if you had a stray dog and you brought them into a clinic, and the first thing you do is you see them growling and biting and you give them an injection that pricks them and it makes them like, what the hell have you done to me? It just works to scare the dog even more. It scares that inner nervous system of us. I don't think that it's the right application, the right way to go about things. Obviously, there is an immediacy needed sometimes with these things. People can get themselves into quite severe situations. But even just being able to go to the doctors and the doctors say, look, I know what's wrong with you, it's fine, but this is what you're going to have to do. Otherwise, this is the only thing we can do. And even just that simple improvement would be such a much better communication. Look, this is all I know is your symptoms, and this is all I have to offer. Here's a different path, and here's the layout of what is happening. It's a reality distrust disorder. You're in a bit of a neuroses. This needs to calm down, and you need to learn how to calm that down. Otherwise, the only thing we have is this at the moment until, we have a specialized hospital, until we have a place to really work out all this literature. And so I think that it's a story, really, and I really do believe that every living person is a story. They are this multifaceted, multidimensional being that has their own upbringing, their own likes, preferences, desires, and questions, and culture, and religion, that they have so much that they probably want to manifest and learn in a healthy way. But the problem is that we don't accommodate that story in any of the treatment plans today. Accommodating somebody's story is not using a medication on them from the get-go. That's not accommodating someone's story. That's telling them, even just subconsciously, you're not right. Something with you is deeply wrong. But whereas if someone's looked at as a story, then it's, all this has happened to you, I'm sorry, and who you are at the moment is exactly the type of response that's normal from someone who's lived your life. And that just feels so much more validating. But I don't know, I've had these experiences where you speak to a doctor, you speak to a clinician, and it's almost like that's gone. There's a white lab coat, there's zero human experience, there's zero almost empathy in a lot of respects. And even if it is empathy, it's an empathy with a sense of paranoia about what that person is. And I think that's because of the breakdown of a fundamental story that makes humans humans. I don't think that people just manifest themselves as crazy because they choose that, or that they work themselves up to that. I believe that the core experience of a human is a human raised in love, compassion, empathy, and understanding. And that produces someone that is within the core experience of a human's expression. But someone who's gone through traumas, abuse, and difficult childhoods, and then expected to fit into a society that is not modelled at all to take care of people like that, or even make allowances for them, and then that person becomes more neurotic. I feel like the approach to look at a person like that and be like, why are you doing this? Take this and, you'll feel better. That it's very strange. It's very detached from the story of the human. And I feel like reframing it to a reality distrust disorder immediately just changes the lens of things. It's like, oh my goodness, you've been through all of that. Maybe all you need right now is safety, and a good environment. But we think about even just the wider implications of something like this. Even in a city, you don't have this relative feeling of safety anymore. There's so much crime, in the UK. So, most people who have these conditions, where are they? I think cities. And I don't know, I haven't looked that up in the literature, but that would be an interesting question to ask. But I feel like if we could understand the story of people better, and through things like reframing adulthood onset schizophrenia to RDD, and see that there's so much depth to the human experience that's manifesting in a very expectable way, we might be able to look at the wider culture as well and say, well, we need to fix a lot. Like, there is a lot of issues going on in the modern culture. There's a lot of unsafe environments happening. There's a lot of bad things happening in the schools. There's a lot of issues everywhere that need to be handled and sorted out. And I feel like understanding the human story, what made us ill in the first place, can be the thing that emanates out into the world that makes people well again. You know, the strongest advocates in the world, I think, who could restore the world or repair the world in a way, would be the people most affected by its failings, right? Only when you felt the sorrow of love do you know its depth, right? And it's that same idea, is that only when you understand how bad something can get, you're motivated to fix it. If you've lived a life where you've never really seen the difficulties or the hardships, and there are people out there like that, it's very hard to see into the difficulties of man and see where the difficulties are. And I think that that's something that is present in the world today. I think that there is a lot of not willful blindness, but inability to see because it's not been experienced. And so the people who have experienced how hard things can be in childhood should be the most motivated and the ones with the loudest voices to try and restore the balance to everything happening around us today. Because you understand how little you can afford chaos because of the effect on your psyches. And that's what I think is the strongest motivator to peace. So yeah, anyway, I just wanted to make this video just to explain what I'm writing at the moment and vent. Most importantly, I think it's good to have an output. Have a good day.